Professor Leonardo, you are welcome to start.
Okay, so good day to all of you. So from the previous presentations that involve very aggressive insect vectors, we now move to a disease that is transmitted by more benign, less aggressive vector, which is snail belonging to Oncomelania, as well as other gastropod snails for that matter. So I'd like to thank the organizer of this webinar, of course, the One Health and Implementation Research Journal, for giving me this opportunity to share with you the situation of schistosomiasis in the Philippines, which is a disease caused by the blood fluke Schistosoma japonicum. Of course, outside the Philippines, schistosomiasis is found in more than 70 countries in Africa, Asia, South America, and the Caribbean. So in this presentation, I shall talk about the prevailing conditions in the Philippines that continue to perpetuate the disease and what the Philippine Health Department has done to overcome these challenges, especially when the pandemic struck, and the way forward for the control and prevention program, especially involving the One Health approach. So this is the outline of my presentation. So next, please. So schistosomiasis in the Philippines was first reported by an American doctor, Dr. Paul Woolley, in an inmate at the National Penitentiary in 1906. This report was eventually subsequently followed by many more cases in the same penitentiary where the inmates are coming from various parts of the country. Next, please. So this slide shows the life cycle of Schistosoma japonicum, and it shows you how integrated the life cycle is with the daily activities of the endemic communities, such as, for example, the daily chores of laundering clothes, washing of dishes, and bathing. The workplaces of farmers, fishermen, and irrigation workers are also very active sites of transmission of the disease. Also shown in this slide are the various stages of the parasite, such as the adult worms, which inhabit the mesenteric veins, and the eggs are embryonated when released through the feces. 50% of these eggs are carried by the blood to different organs, such as the liver, the lungs, or even the brain, where these eggs would cause pathology in these organs. The other half are eventually released into the environment and could sustain the life cycle if the infected person defecates in bodies of water. So the eggs would hatch readily and release the ciliated miracidium that infects suitable intermediate hosts, such as Oncomelania quadrasi in the Philippines. So in this host, the miracidium transforms into mother sporocyst and then undergoes asexual multiplication to give rise to several daughter sporocysts. And each of these daughter sporocysts would also similarly undergo another round of asexual multiplication to finally give rise to the cercariae that leave the snails to infect the definitive hosts like humans and other mammals like livestock such as carabaos, cattle, sheep, and domestic pets like dogs and cats, and even the wild ones like rats. So the involvement of reservoir hosts points to the zoonotic nature of schistosomiasis. Next, please. These are severe cases of schistosomiasis that should not have reached this stage had treatment been given early. It is therefore a pity that even with an effective drug like praziquantel, there are still cases that end up like this because of poor health-seeking behavior and misconceptions about the disease. Next, please. Severe forms of schistosomiasis can eventually result in death, such as shown in this slide, where the liver and the lungs are heavily affected. Next, please. So this is a case of a farmer diagnosed positive for the disease and whose ultrasound showed a cirrhotic liver. He has been a farmer all his life, and he confessed to us to never having participated in mass drug administration because he thought that there is no point since he will be repeatedly reinfected because of his exposure in his farm. Next, please. This is the distribution of schistosomiasis. It has a strictly focal distribution in the Philippines, confined in areas where there are snail intermediate hosts belonging to the species Oncomelania hupensis quadrasi. These areas are characterized by continuous rainfall all throughout the year with an indistinct dry season. The disease is perpetuated by poor environmental sanitation, inadequate supply of water, contact with contaminated water, and presence of infected mammalian reservoir hosts, such as what I have mentioned earlier, like water buffaloes, dogs, and rats, among others. So the 28 endemic provinces have been stratified as high prevalence, moderate prevalence, and low to nearing elimination level. Next, please. So overall, there are 12 of the 17 regions that are endemic for schistosomiasis. So that's 71%. 28 of the 81 provinces, which is 35%. 196 of the 1,489 municipalities, which is 13%. 15 of the 145 cities, that is 13.8%, and 1,609 of the 42,306 barangays or villages that are endemic to schistosomiasis. It is estimated that 3.4 million people living in endemic areas are directly exposed to disease transmission sites. Next, please. The stratification of endemic areas is now determined at the barangay level. So a barangay or a village is equivalent to a village with a population of 5,000 or more. In the past years, the national program, together with partners, have been doing focal surveys in order to determine the prevalence of schistosomiasis in each barangay. Because of the focal nature of the disease, the purpose of the focal surveys is to stratify the barangays based on the level of prevalence, which in turn will be the basis of the package of interventions customized for each barangay. So as the disease prevalence goes down, and the program succeeds, adjustments in interventions are made towards an approach that is more focused on residual areas of transmission and combination of interventions. For example, mass drug administration combined with other public health interventions. Next, please. The next slides show the actual situation in endemic areas and would explain the difficulties in the control of schistosomiasis in the Philippines. Next, please. The inadequate water supply forces people to do their laundry and bathing in contaminated water, exposing them to infection with Cercariae. Because of the lack of toilets, people defecate anywhere, aggravating environmental contamination with schistosome eggs. Next, please. Children mostly get infected by bathing and adults by performing domestic chores in contaminated water. Next, please. The traditional method of farming uses carabaos, which are very good mammalian reservoir hosts. The use of rice varieties that require too much water also contributes to perpetuation of the snail habitats in rice fields. Next, please. These types of water supply create poodles of water that can support snail populations. Wastage is high because water flow is not regulated. The importance of water capture technology and bringing water to households has been reiterated in many consultative meetings held in the past. Next, please. In many poor endemic areas, the kind of toilet or latrine leaves much to be desired. Many are not water sealed, and if they are, the lack of water supply forces the community to eventually abandon the use of communal or public toilets. Next, please. Perpetual flooding in many endemic areas expose the villagers to schistosomiasis. Heavy rains can cause floods, or overflow from rivers during high tides could flood residences found along banks of rivers or streams. Next, please. And the snail habitats are just right there in their homes. Next, please. So the next slides would show the various strategies and activities in the current control and prevention program for schistosomiasis in the Philippines. In the Philippines, the schistosomiasis control and elimination program's overall goal is to eliminate schistosomiasis as a public health problem in all 28 endemic provinces using various strategies such as preventive chemotherapy and infection control, transmission control, public-private partnerships, advocacy and social mobilization, and monitoring and evaluation. Next, please. The goal in high to moderate areas is to eliminate morbidity through mass drug administration of the exposed population. Once the prevalence has been reduced significantly to very low levels, this status will be sustained through strengthened active surveillance of human and snail vectors, infection control, transmission control such as sanitation and hygiene by way of health infrastructure, provision of safe water supply, and water-sealed toilets, and ordinances to control the animal hosts. Mass treatment as well, especially for school children, and quality control of laboratory and laboratory staff. To date, 2 provinces have not shown cases in fecal surveys to determine prevalence. Over the past 5 years, there have been 5 provinces and 2 cities that have less than 1% prevalence. Next, please. A partnership is being promoted to solve the problem of schistosomiasis. Public-private partnership is expected to address various aspects of the disease. Partnership with the Department of Agriculture, especially the Bureau of Animal Industry, would seal the latter's involvement, especially in addressing the reservoir hosts component in intervention programs. Other sectors involved in the partnership include education, health, local government, the academe, public works, irrigation, and so on. Next, please. The next slides would show some initiatives in the past which have been undertaken to show that significant progress can be achieved in the control and prevention of schistosomiasis. Gonzaga in Cagayan Valley was the site of a multi-country project of the International Development Research Center of Canada, which aimed to develop the eco-health approach in the control of schistosomiasis. This approach intensified the multidisciplinary, multisectoral, and multi-agency involvement in the control of schistosomiasis in the Philippines. For the first time, other sectors such as the animal sector was made aware of the critical importance of addressing the role of reservoir hosts and the environment in controlling and eliminating schistosomiasis. CONCAN was a part of this multi-country project, and this approach was a huge success in the Lawa model of the control and prevention of Opisthorchiasis viverrini in Thailand. Next, please. In transitioning from control to elimination, these challenges have to be overcome. A surveillance system based on highly sensitive diagnostic technique is essential. Capacity building has to be intensified for surveillance works. On top of these challenges are changes that cannot be stopped and seem to be railroading control efforts, such as construction of dams, floods, deforestation, and global warming. Next, please. When the pandemic struck in the early 2020s, WHO issued pronouncements on postponement of NTD surveys, active case finding activities, and mass drug administrations, all of which involve people gathering together in one place or very close physical interaction among people. There were activities that were encouraged to continue, such as prompt diagnosis, treatment, and essential vector control to prevent any further exacerbation in the NTD status in particular areas, like those with high prevalence and high intensity of infections. Next, please. From the status report of the program manager of the Schisto Control Program, he enumerated the following effects of the pandemic on the NTD programs in the Philippines. Following the WHO advisory, there was cancellation of NTD plans, programs, and projects implementation, and delay in the implementation of ongoing plans and activities of the NTD programs. The so-called COVIDization of the programs was reflected in the mobilization of the technical staff and the repurposing of the office line function for COVID-19 response and realignment of programmed NTD funds and resources to support response to COVID-19 operations. Next, please. But in the midst of the pandemic, measures that have been in place for NTDs were further intensified to fight COVID-19. These include WASH, the use of the NTD surveillance mechanism, and health promotion and education platforms. Next, please. While the COVID-19 pandemic, compounded by calamities and disasters in the country, no doubt stalled the progress in the control and elimination of schistosomiasis, and possibly even offset the gains of the program. Some program implementers went out of their way to even innovate to improve service coverages. Next, please. Good practices that led to wider MDA coverage included house-to-house approach, distribution of groceries, especially at a time when many households could have reduced incomes, frequent orientation to respond to questions about mass drug administrations, strong support from the local government units, strong partnership with NGOs, and more extensive information dissemination. Next, please. The Philippine Department of Health will complete the design and development of a national policy and guidelines on the control of animal schistosomiasis in close collaboration with the Department of Agriculture, Bureau of Animal Industry, using the One Health approach. Stratification of endemic areas will be continued and completed, and designing the conduct of mass drug administration in the midst of the pandemic and in preparation for future emergencies. Next, please. Prior to the pandemic, the schistosomiasis program has been confronting challenges. Climate change is one which continues to impact our lives, particularly our health. Nonetheless, there have been good practices that have pushed the program forward in its elimination efforts. Given all of this, in the end, how the Philippines will get the upper hand over this disease will depend on how strong the forces of our challenges will pull us back vis-a-vis the advantages that we have at present that can push us forward. We have better approaches to schistosomiasis control, hopefully covering all aspects of schistosomiasis, such as the biomedical, social, cultural, economic, behavioral, and ecological aspects that will help us develop better intervention measures. We know we need better technologies, and we are developing them to track down the remaining holdouts of schistosomiasis in order to reach elimination. We develop models that can guide us on proper combinations of interventions in various epidemiologic settings. As a result of the pandemic, we have established more development partners in investing in WASH and even in primary health care. Research is non-stop, whether basic, applied, or operational. Lastly, we have people who have made it their mission to work until the last trace of schistosomiasis can no longer be recognized as a public health problem or ultimately eliminated. Therefore, so much rests on our decisions at present. As we transition from emergency to the new normal, we make sure we learn from the hard lessons thrown at us in this pandemic. We make sure that this new normal is a better one, that our new normal schistosomiasis program is resilient and can endure the challenges it encounters, and at the same time integrate, modify, adjust according to demands. Let us also not forget that we have sustainable development goals to achieve that should not be forgotten or set aside as we all journey to recovery. Next, please. So thank you very much for listening.